We get asked when we work with producers and veterinarians in the field, what tests do I request? And then sometimes when you get a result back, what does that mean in terms of, is it the cause of a clinical problem? Is it not? Is salmonella always there? So we wanted to do a trial to better understand the sensitivity and the association of different tests with clinical signs, and also understand their relationship with shedding.
Welcome to the Swine Health Blackbelt Podcast, the latest swine health research digested for you. My name is Dr. Clayton Johnson. I'm the host of the podcast. And joining me, coming back onto the podcast, is Fernando Leite. Fernando is the Associate Director of Technical Marketing with Boehringer Ingelheim Animal Health. Fernando, thanks so much for coming on. Maybe folks didn't see the first episode we've done together a little while back. And for those folks, why don't you introduce yourself to the audience?
Hi, Clayton. Yeah, pleasure to be back. Thanks for having me on. So my name's Fernando. Originally from Brazil, got my vet degree there. Got a master's degree at Iowa State University on veterinary microbiology and immunobiology, and then got my PhD in Minnesota in veterinary infectious diseases, focusing on Salmonella and Lawsonia. And after the PhD, I've been with Boehringer ever since. So.
Well, Dr. Leite, you're a young guy. However, you have done a lot of research in your short amount of time here in the industry, and you've worked a lot with enteric pathogens. You're here today to talk to us about some new research you've done with Salmonella Diagnostics. So, without further ado, why don't you talk to the audience about what you've been working on?
Yeah, absolutely. We presented this study at ASV earlier this year, and it was a great collaborative study. Um, to begin with, Salmonella, of course, it's a BSL2 pathogen, so we did this with VRI and Ames, Iowa, and really glad to collaborate with some great people. Kent Schwartz, who's a guru, I think, in all things enterics as well, and we collaborated on that, and some great people at the Iowa State Diagnostic Veterinary Laboratory as well. Um, Fundamentally, we get asked when we work with producers and veterinarians in the field, what tests do I request? And then sometimes when you get a result back, what does that mean in terms of, is it the cause of a clinical problem? Is it not? Is salmonella always there? So we wanted to do a trial to better understand the sensitivity and the association of different tests with clinical signs, and also understand their relationship with shedding, right? And so in this trial, it was a very simple trial, two treatment groups. We had a control non-infected group, and we had another group that was we experimentally inoculated salmonella. We did use the monophasic serotype. That is still, the predominant serotype associated with clinical disease in pigs. And I'm sure, the audience knows as well, enterocolitis is the main clinical presentation when it is clinical of monophasic, and diarrhea being the primary clinical sign there. Um, and so we compared routine diagnostics. We pretty much submitted the fecal samples for them to be processed routinely as somebody in the field would submit them to a diagnostic lab. And we compared then direct plate culture, and PCR of feces, and we compared these two to a gold standard, if you will, which would be enrichment. And this enrichment was, we used a greater volume of feces, and we also, it was an enrichment culture specific to the challenge strain to really have a good positive control to know the shedding status of that pig. And so we tracked these pigs for 7 days, understanding that, salmonella generally is acute disease, and most times self-limiting as well. And so we challenged pigs, and then we tracked them daily for 7 days, and we collected feces. This challenge model has been described. Clinical signs generally peak at 2 to 3 days post challenge. And so we collected feces at 2, 3, and 7 days post challenge. And then we just compared the sensitivities of these different tests, and we correlated them back to, did the pig have diarrhea or an altered fecal score at the time of collection.
Very good. And I know you presented this information here recently at AASV. Congratulations on doing that. Talk to us about what you learned with the results, right? Which of those tests gave you the greatest sensitivity? And certainly, Fernando, I welcome your interpretation, right? Can we be too sensitive potentially with some of these tests? Is that a concern at all?
Yeah, great question, Clayton. So the positive control, or the gold standard, if you will, that we utilized, that enrichment, it was positive 100% of the time. So the negative control pigs were negative. However, all of the positive pigs following challenge were positive, meaning they were always shedding.
That's
And I
impressive.
think, yeah. And you asked a very important question, right? Is it always positive, and what does it mean, right? So the direct culture, it was only positive 56% of the time. So the direct culture plating that would be routinely done, it's really not sensitive if you want to know the shedding status of a pig.
Yeah.
And there were 17 instances where a pig had diarrhea and we collected a fecal sample. And of those 17 instances, it was positive 82% of the time. So the sensitivity in a clinical setting for direct plate culture is pretty good.
Okay. Yep. So you're saying the 80+% was sick pigs with the normal culture method, not the gold standard.
Right.
Um,
The normal direct plate, yeah, brilliant green auger, what many labs do for direct plate culture.
okay, very good. I think
Yeah.
that's really important, right? Because it's always this way with endemic pathogens. Your infection point is a great one, right? But we know that a pig is likely infected with salmonella. It's
hmm
pretty hard to find pigs that are not commercial pigs that are not infected with salmonella. It's
hmm
ubiquitous. So that really is helpful to differentiate. Well, if I do the gold standard method, I will find it, but it just tells me infection status. It really doesn't infer a lot as it relates to disease.
Right. And if you have a positive with direct plate culture, the chances are it's shedding a very, very high amount, and it tends to be associated with clinical disease.
Yeah. Can you get any sort of quantification on the culture, Fernando? Is that practical at all from a lab standpoint to offer up? Can you
hmm
look into the few, many, a lot, that sort of thing that might show up on the lab report and read anything into that?
Yeah, I mean, with any enteric pathogen, the amount is generally correlated to the clinical, you know, presentation, right? The more is present, the more likely it's associated with the clinical disease.
Hmm.
Here, we didn't even take that into consideration. We just said, is it positive or negative? And in most cases of clinical, it was positive, but it was also negative in many other cases.
Okay.
Um, and the interesting thing, just to add on to this, Bailey Aruda, Kent Schwartz, and Eric Burrow, they published a paper where they looked back in diagnostic cases, and they utilized also direct plate, or cases where direct plates were positive. And if a direct plate culture is positive for the monophasic salmonella, there's a significant odds ratio of there being a lesion in a pig.
Okay.
And what we're finding here is not only, adding to their research, they found a significant association with lesions. We're finding that it's mostly positive in cases of diarrhea. If there is alteration of a clinical a diarrhea there in the pig.
I'm glad you brought up monophasic, Fernando. And if I remember right, you said that the challenge was with monophasic, which is what you're seeing in the field. And monophasic is kind of a unique beast, right? You came on the podcast before and educated us that this thing behaves a little different than some of its ancestors. Do we know much about interpretation across the different isolates of salmonella that producers might deal with? Can these results be extrapolated outside of just monophasic, or we need to do some more research on other serotypes, other isolates to be able to make that interpretation?
Yeah. When we think about the sensitivity of a swab or direct plate culture, it's not sensitive at all, you know. And it goes back to your question about the quantity. There has to be a very large quantity of salmonella to be shed for you to detect it with direct plate culture. Not always with enrichment and depending on the enrichment techniques, but if you're just getting a fecal sample and swabbing it on a plate, there has to be a large amount of salmonella present. And so I do expect it to be these findings to be correlated to other serotypes. Of course, always associated with the clinical picture of the pig, right? But there's such lack of sensitivity of a fecal swab for salmonella and without enrichment as well that I do believe that there would be some cross between this and other serotypes if you find them without enrichment and with a direct routine culture. One other thing that we did in this study that I think is really, really important is we also evaluated a PCR, a direct PCR in feces. And it was quite surprising to find how lack of sensitivity this PCR had. Generally we think PCR, it's a great sensitive technique to detect pathogens, in feces and in, oral fluids and things. But for salmonella, it only detected 4 out of the 17 cases when a pig had diarrhea in this particular study. So the sensitivity of the PCR for salmonella that we encountered in this study was very, very low. So I think a take home from this study too is just do direct culture. Direct culture seems to be positive in most cases when a pig has diarrhea, and interestingly, the PCR, did not perform very well.
Yeah.
Salmonella presents significant challenges to pig health and performance and poses food safety risks to humans. As the first and only vaccine offering live attenuated strains of both Salmonella cholerae and Typhimurium, Enterosol Salmonella TC from Boehringer Ingelheim protects pigs against both serotypes with a single oral dose. Talk to your Boehringer Ingelheim representative to learn more.
Well, I appreciate, Fernando, you doing this work. It is very needed because diagnosis of endemic pathogens is difficult, period, right? Diagnosing the infection, not very hard, but it's really difficult in situations where infection does not equal disease. We're not talking about PRRS or PED or African swine fever, right? Some pathogen that when we find it, we don't like it. We're talking about a pathogen that is going to infect all the pigs. And we're talking about a pathogen of which there is a lot of different choices on the diagnostic checkbox for what we want to do with it. So you helping to demystify that and shine a flashlight in that black box really, I think, will help reduce confusion, which lets us better utilize the technologies we've got available to us. So thanks for doing the work, and thanks so much for coming on and sharing it with us.
Thank you, Clayton. Yeah, my pleasure.
Hey everybody, we're always searching for the latest and greatest research to share each week. If you have a swine health related research trial and would like to come on the show and talk about it, share it with us, please feel free to email the research to hello@wisenetics.com. That's HELLO@WISENETIX.com.